Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and Dr. Thomas Pane is joining us once again for the question of the week. And Dr. Pane, we have a question that came in from our Facebook audience. The question is, what is the best facelift procedure for a thin, saggy face? And more details on this is, person is 65, slim with a long face, and it's been suggested to them that fat grafts would not be successful in their case, and they don't have the quantity or quality of good fat supplies. They've been contemplating a facelift for many years, and fat grafting to deep folds and a lack of volume has been suggested, but this comment about the success of the procedure is a little bit confusing. Also, they're curious about the healing time for nose surgery at their age. So, Dr. Pane, what would you suggest in this situation?
Well, in this case, based on the age and the description that the skin is thin and saggy, I don't think a lot of the non-operative things are going to work real well. And, you know, that being said, you have to kind of have an in-person consult and see if maybe laser or something might tighten up some of the smaller wrinkles. But if you're talking about doing a non-operative procedure or only fat grafting without excisional surgery like a face or neck lift, then that probably isn't going to work. Now, the term that there's not enough fat for fat grafting, I don't really understand that, because you are not talking about large volumes of fat when we talk about fat grafting to the face. The areas that we do, the cheeks, the nasolabial folds, sometimes around the lips, depending on what the thoughts are, almost everybody has enough fat for these areas, because you are not talking about the kind of volume that we have to put when we do fat grafting to the breasts or backside, or if we're filling areas that have been treated with liposuction and didn't come out quite right. So I would say somebody that does a lot of facelifts and does fat grafting to the face is going to almost certainly tell you that you do have enough fat. The question is, where can we get it? But that's not too difficult. So you would probably be talking about the best option is going to probably be a face with or without a neck lift, depending on how lax the tissue is there, and consideration of adding fat to the nasolabial folds and cheeks, which can enhance the results in almost all cases, depending on what the starting volume is. Healing time is not very long. Facelift surgery is very well tolerated. It's not that stressful to your body. When it's done by somebody that knows what they're doing, you should have very minimal to no pain. You got to take it easy for a while so that things heal properly. And you are talking about a downtime of close to a week, depending on how comfortable you are being in public with, you know, a little bit of fresh incisions. Down here in South Florida, people don't worry about it that much. We make it so that there's as little bruising as possible, and people are usually up and around and doing what they want about 3 to 5 days. So I'm not too worried about that. But that's the overview of whether or not, saggy skin can be handled non-operatively. Usually not in most cases, and fat grafting an option in almost everybody, depending on what the goals are and what we've got to work with. So hope that covers it.
Thank you, Dr. Pane. And if you have a question for the doctor, please visit our website or Facebook page. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.